Quality is a little bit challenging to define in terms of cancer treatment because it can be defined extremely broadly as the right treatment at the right time in the right place. And it can be defined as something as specific as the number of nodes that you would remove when you're removing a colon tumor in a patient. And so I think that we are all struggling with how to define quality in cancer treatment. But I think that what patients should worry about is whether or not the physician is well trained and has board certification in oncology or radiation oncology or oncologic surgery. The number of cases that that physician is taking care of is extremely important. The number of surgical procedures that the surgeon is doing is extremely important. And the thing that a lot of patients don't think about very often is the nursing care. Chemotherapy is extremely dangerous. The drugs are toxic, and it's very challenging to make sure that when you're infusing high volumes of chemotherapy to many, many patients, that there is a system for checking and rechecking that chemotherapy to make sure that the drug is correct, that the dose is correct, and that the administration is correct with the correct supportive drugs. And so nursing becomes such an important factor in the quality of care. Oncology nurses should be specially trained in cancer. And there are certifications in oncology nursing. And that's a good question for patients to ask when they're getting cancer treatment about the training of the nurses that will be giving the chemotherapy. And it's also extremely important for those nurses to be very, very knowledgeable about the side effects of cancer treatment, about the long-term effects of cancer treatment. And that education mostly is coming from the nurses, both during and after treatment, and it becomes extremely valuable to patients as they finish treatment and move on to go back to their life.